And we welcome you back to On the Beat, everyone. Isaac hosting again this week. And this week we're talking about diabetes. And I have with me Dr. Abir Zainal from the Golden Triangle Endocrinology from the Baptist Medical Group. Dr. Zainal, we appreciate you joining us on the Beat this morning.
Thank you for having me.
All right. So we're going to talk about diabetes, obviously impacting a lot of folks, especially in the Southeast. So first off, new to the disease, what are the different types of diabetes? I've heard personally of types 1 and 2. Is there any others, or is it just types 1 and 2?
Yeah, that's a great question. So there's different types of diabetes. The main ones are type 1 and 2. So type 1 diabetes usually affects younger individuals. The immune system produces these proteins that actually target the pancreas. Our pancreas makes insulin. And so these proteins actually damage the pancreas over time, and our pancreas does not make enough insulin to store sugar. So that's the first type of diabetes. Type 2 diabetes is usually caused by genetics and also by an unhealthy lifestyle that leads to a person still producing insulin but not responding to it as well. That's what we refer to as insulin resistance. And so the blood sugar levels climb. But over time, the pancreas gets tired and actually doesn't make enough insulin to store sugar. The other forms of diabetes are, gestational diabetes, which occurs during pregnancy. It's a more, could be a reversible type of diabetes related to pregnancy hormones. And then we also have pre-diabetes, which is when our sugars are elevated, but they're not elevated enough to be diabetes and can progress to type 2 diabetes.
Okay. You mentioned type 2 diabetes and complications, or you said unhealthy lifestyle. What would be like one example of something that we could all improve on, I guess? Yeah,
absolutely. I mean, a healthy lifestyle is really paramount in controlling diabetes and making all forms of diabetes easier to manage. So maintaining a healthy, balanced diet, like a Mediterranean-style diet, reducing late-night portion snacking, increasing physical activity as tolerated. Goal is about 5 days a week of a just brisk walk, 20 to 30 minutes, really improves diabetes control.
Appreciate that extra input, especially I'm guilty of late night snacking for sure. So how do we go about diagnosing it?
So there's different ways to diagnose diabetes. There's a test called the hemoglobin A1C test. You don't need to be fasting for that. That looks at how much sugar is attached to your red blood cells. And it gives an average over 3 months. Your doctor may also order a fasting blood sugar test and also a random blood sugar test. So there's different ways. If there's a concern for type 1, they may also run some additional tests to see how much insulin you make or if you have those proteins we talked about.
All right, that's good to know. And then lastly here, if not treated, managing diabetes, but you said there is a chance it could be reversed or be treated. So how do you go about doing that?
So this is really an exciting time for treatment of diabetes because we have so many new advancements in medicine. Your doctor may prescribe pills to control your diabetes, protect your heart, and protect your kidneys. You may need to be on one insulin shot a day. If your blood sugars are still rising after the meal, you may be on a different type of insulin as well to prevent that rise. This is the time also where we have insulin pump technology that gives insulin at an hourly basis. And then we also have continuous sugar monitors that go on the arm or the tummy and can actually communicate with the device to send a blood sugar or an estimate of a blood sugar to your device every 5 minutes. So it's really an exciting time. There's so many different forms of treatment.
Sure. All right. Well, Dr. Zainal, that's some excellent information. We sure appreciate you joining us this morning and spending just a little bit of your time with us.
Thank you so much.
All right. If you would like some additional information, you can head to the website or phone number there listed on your screen. We'll be back after this.